Alright.
I haven't heard that one
They didn't
before.
see the start of that, so I'm gonna be like, why are you slapping her? That doesn't sound very friendly. Alright, so we were just kind of thinking, like, I've got you, Rosie, for maybe another 5-10 minutes. What content could we quickly film in this time? And we were just kind of having a discussion, like little mini reflections on, you know, how far we've come and stuff. And we're saying how, you know, in the beginning of our course, we didn't really know what a session looked like. And
beginning of the course, we're about halfway through the course.
halfway through the course, it can feel like, I don't know what like a session looks like. You're doing assignments where you're creating sessions.
And you're like, what on earth is this supposed to look like?
Yeah, just like what it actually, and then, but we were saying then that even within different settings, like physical rehab, mental health, pediatrics, a session can look so different as well. So we possibly could have seen a session and just not realized it, or
Yeah.
I think it's different sitting and shadowing a session and then running a session and then becoming confident.
But then
Like,
I
there's a
always had the
progression.
it was funny with me because I always had the misconception that there was always this formula that all OTs went by, and I had no idea what this formula was. I didn't realize that part of a session could just be like sitting down and talking to someone, like just negotiating how a kitchen is rearranged, or just explaining to them why it's important to use a diary. Just really simple things that these could be conversations that you had with a friend, and that could be arranged like a conversation that you have with a friend, but just in an OT manner in which I'm speaking, like how you react to the person, how you read their cues, the type of language that you use is still within all those things that you learn in uni, but it's basically just with adult rehab, which was what I was in. It was basically conversations with my outpatient, and maybe just going through some exercises, seeing what worked, what didn't work, and then coming up with a program.
So like some things can be really, like today we're working on our goal of something upper limb, moving our hair, like something really specific. I would hear about the guys that are working in rehab, but then for us in mental health, we didn't really have sessions. We didn't really do interventions in the setting I was in. It was more assessments and running a sensory group. So it was entirely different again to what you were doing. And so a session,
we did like sessions where you did an assessment, because some assessments run
would
up
you call
to
that
45
a session?
minutes.
Would you call like
Yeah,
doing an assessment a session?
Yeah, I called, well, they were booked in for the hour we did the assessment. That was a session.
So that's different. So you had to book people in?
Yeah, I had to book people in. So much like how you go and see your GP, you get booked in for a time slot, which for us was an hour. In that hour you'll say, hi, I'm Rosie, how's it going? This is what OT does. This is what I thought we would do today. I know that you have cognitive difficulties. You're having difficulty managing your day and everything's coming just very muddled. Okay, let's have a look at diary. How are you arranging your diary? Show me this, and then we'll help arrange the diary. They might tell me something else and I go, oh, I know what'll help with that, and then so it's a very kind of, for me it was a very flexible thing. You could not plan for a session because the patient might tell you something and then you just have to react to it.
Yeah.
And
that's just,
that was my little spiel.
that's totally different.
You'll learn very soon that I'm not a usual person who can't look at the camera lens versus the little screen on top.
Yeah.
Oh dear.
I kind of miss placement already. It's been 1 week of placement. I just miss being on the ward and seeing everyone, and I don't know.
Well, see, I've been away from placement for about 3 weeks now, but I work as a support worker in an aged care organisation, and they've been giving me a lot of work recently. And look, it's not OT, and it's really hard not to use OT skills, but I don't know, I've had those relationships with clients, which is what I really liked about the placement. So I'm not missing it so much, but I don't know, different things.
So after like that placement, I know I said a few weeks into it, or not maybe a few weeks, maybe like halfway into my placement, that like I could see myself working here and doing this job and like fitting in. And could you see yourself like graduating and working in a role similar to what you were on in placement?
Yes, I could with this one. I couldn't with the pediatrics. In hindsight, I think it was more so the organisation which I had difficulty kind of fitting in with. because I wasn't good at writing reports, and that was a big aspect of it. But with this one, I can see myself, because I was in a hospital, but I can see myself in a community-based setting doing a similar thing. I see myself as an OT now.
We went out, we shadowed kind of a community outreach team, and it was nurses who we were shadowing, but OTs could work, I think, in that role. And I loved it. Like, just going out, and it was like a drugs and alcohol kind of group, and so I was working with a lot of people, like homeless people as well, or people like secondary homelessness, like the different types, like in hostels. But they used a lot of motivational interviewing when they were talking to like their clients or consumers. I'm not sure what language they used, maybe patients, maybe clients, maybe consumers, I'm not sure exactly, because the language changes. But just going out and making those connections, checking in with people, using those motivational interviewing. And I don't know, I got to sit in the room when they were talking to one of their consumers, like talking them through like a tough time they've been going through, and just sitting back and going, that's motivational interviewing. I like this. I could sit there and do this with that, and I could get a lot, like I could just see myself doing that. Yeah. And so it sounds like you kind of got that experience from your last placement. Yeah,
yes, I did, because I think I had because pediatrics in the setting that I was in, to me, was very vague. I didn't really know what I was supposed to do most of the time. But with this one, it was nice. It was kind of clear cut as to, this person's got A, I'm going to do B. So more kind of clear cut, which is what I appreciated, I guess. But no, but I'd look at how my supervisor was talking to a patient, and it was basically a conversation around things that could help. And I'm going, I can do this. This is all right. This is me helping another person and what they need.
I think that's interesting, because I know with the person I was on placement with, we were quite different in that he did prefer more physical rehab, where it's more structured. You come in with a stroke, we can do this, this and this. This is usually going to be the outcome. Whilst I liked pediatrics and mental health because it could be so vague and open, and each approach was so individual to that person. And I felt like it was just personalized to who they were. You couldn't just do a kind of cookie cutter approach for everyone, and I loved that, how it was so different each time. And
that wasn't
interesting how we're so different.
Yeah, no, I couldn't do that, just because I would be so unsure every step of the way what I was supposed to do.
It's so like, you could take this in 10 different ways, and that's kind of like anxiety provoking, like, oh, I could have done it this way, I could have done it this way, and you just kind of justify to yourself, you've got these resources, you've got this amount of time, you've got this experience, you know, at this point in time that was the best you could do, and that's all you could do. But it's nice that kind of demonstrates, even within OT, you can have those different preferences for types of settings and work, and you can find both within OT, it sounds like.
Yeah, and even saying that, like, I can see myself in 10 years time, after I know more about OT and more sure of myself, I can see myself maybe going into a different role where it's more vague, after I've gotten that experience.
That wealth of knowledge, you just feel more comfortable.
I'm the type of person who needs that wealth of experience to be confident to do something. So I'll still do it, but I feel more comfortable having that experience.
I could just hear something happening.
Yeah, it's all good, people. It wasn't a bird pooping. I've had that happen.
Well, thank you, Rosie, for sharing your insights and valuable experience and knowledge and advice. Do you have any last pieces of advice? Just anything off the top of your head? Placement.
Have fun with it. Don't forget to have fun with it.
Don't lose
sight of who you are.
And that playfulness and that.
Because I think that's in some ways the best medicine sometimes.
And I think that's something I saw also, actually. So I was in the hospital setting. I saw other health professionals they seem to have lost a lot of that kind of playful, that humanness, that probably because they were so stressed and they had so much going on. But I remember one occasion when someone on the treating team came up to ask for a referral. It was like the first time we'd interacted, and she just kind of went straight to the point. I was like, hi, my name's Thalia, I'm an OT student, how's your day going? And she was just so taken aback that greeting. Oh yeah, sorry.
Yes, I've had that happen before as well. Yeah,
they're just so And
you forget human relationships in a way because you're so busy. So, don't ever forget who you are as a human. And at the end of the day, find the opportunities to enjoy yourself. That's deep.
Put it on a t-shirt. I'll see you guys in the next one. Don't forget to like, subscribe, comment. Bye guys.